Namaste. I am Dr. Kosygan, Senior Consultant Orthopaedic Surgeon at Apollo Hospital, Greens Road, Chennai. My primary area of practice is joint replacement surgery, particularly of the hips and knees, both primary, complex and revision joint replacement surgery. Now, robotics has entered our lives, and so also in medicine, particularly in the surgical field. And we now do joint replacement surgeries using the robot. Now, one common concern or maybe dilemma for the patient could be is what do they choose, a robotic or non-robotic joint replacement surgery? Now, for this, we usually give them the details as to what are the key difference between the two. And when we mean robotic joint replacement surgery, it is not the robot doing the joint replacement by itself in isolation. An experienced surgeon gets even better by the use of these technology, because one of the very key and important aspect of getting a joint replacement right is placing this implant in the precise position inside the joint. Now, this we could do manually with the use of standard jigs or with the help of navigation, whereby pre-surgically, before surgery itself, a CT-guided navigation helps us to understand the geometry of that particular joint of that person and then decide how much bone and cartilage has to be removed. It also gives us as to what alignment or position we can implant or place these processes into that knee or hip so that they will get the best functional outcome. So it's all about precision, which is what we aim in our day-to-day life in most of the fields, and technology has helped us to achieve that in knee joint replacement and hip joint replacement as well. So do not worry that this robot is going to perform the joint replacement on its own. By minimizing the amount of bone we have to remove and amount of disturbance to the soft tissue we have to do during the surgery, that is the muscles and other tissues around the joint, the post-operative pain is also likely to be less, and once again helps us to achieve this goal of getting the patient mobilized early after surgery, discharge them in a much shorter period, and enabling them to return to their day-to-day independent level of activity much earlier. So it's the use of technology and our experience to achieve a much better joint replacement and provide the patient with a better choice.